Hello, my name is Shamir. Thank you for the opportunity to interview today. This is a situation where we're looking to balance between patient autonomy, informed consent, beneficence, and non-maleficence. And so to answer this question, I'm going to first talk about the important and the usage of AI in healthcare, some of the limitations of AI. Afterwards, I'm going to talk about some of the pros and cons of the situation and how I'd approach getting more information. I'm going to wrap it up talking about a personal experience of mine relating to this and how I believe that this is a really important prompt regarding our future as a dentist. The first thing I'd want to do in this scenario, before relying on any AI diagnosis or anything like that, is ensure that I'm staying composed while talking to my patient. If my thoughts are scrambling or I am showing the fact that I'm not confident in my diagnoses, then my patient may have some anxiety creep into their mind and creep into the decision. So I want to make sure that I am showing off to my patient that I am confident and I am assured in my judgment. My first step in this would be to first just double check myself, to look at the patient again and just do a visual inspection myself to ensure that I do not believe that there is a case, and that just to make sure that I didn't miss anything on the x-ray or anything like that, maybe rerunning the x-ray a second time just to get a second look and to reconfirm my diagnoses. After confirming and taking a second x-ray and confirming my diagnoses, I would reach out to another senior doctor in the room. In these situations, it's important to acknowledge our scope of practice. And so, if I am not feeling confident in my ability to read x rays, I may reach out to a radiologist who is in the clinic and ask them if they can double check the x ray with me. If after reaching out to the radiologist, they confirm that, yes, I believe that there is no need for the cavity and they are also in disagreement with the AI, the next step I would go on to is I would talk to the client. I would tell my patient directly that based off of my professional opinion and my colleague's professional opinion, we believe that this is not needed. However, I would also let the patient know about the AI and what the AI software told us. While discussing with the patient, it's important for us to acknowledge some of the limitations of AI. There are many pros of using machine learning and artificial intelligence when it comes to streamlining decision making and having a solid standard to work off of. However, we also have to understand some of the concerns when it comes to things like over reliance and bias. When I'm discussing this with my patient, I'd want to explain both the pros and the cons. I would talk about that the pros of not doing the filling are that it's a less invasive maneuver and it's a little bit more conservative and it gives us the opportunity to not have to do any invasive technique. However, I would also make sure that the patient understands that if it is the case where something has to be done and we may not do a filling, that it could progress further on. I'd also explain to the patient that if we do indeed do this immediate filling, that there could be other further consequences. After discussing this with my patient, I want my patient to feel comfortable in the decision making and give him space to internalize everything and understand what's happening. Afterwards, I would explain to the patient that I personally would recommend going forward with the AI in this case. I would explain the fact that although me and my colleague may have missed something, the fact that the AI was correct 8 out of 10 times in these situations means that statistically it's more likely to be correct. I would also want to explain to the patient that the risk of us not doing a filling and being wrong is significantly greater than the risk of us doing a filling and being wrong. I would make sure that my patient understands the fact that if it is the case where there is a need for us to do a filling here and we skip it, that this could compound over the next couple of years and that it could cause the patient to need to come back for a much more severe diagnosis because of the compounding effect of healthcare. In a situation like this, it's really important that I am following the principles of beneficence and that I'm doing the best care I can to my patient and not doing any harm to him. However, it's really important that my patient understands the fact that I am using AI in my diagnosis because informed consent is very, very important in this situation. If it is the case where after I explain everything to my patient and my patient completely rejects the use of artificial intelligence in this decision making, then I would continue with my own diagnosis, but I'd ensure that I reschedule my patient for maybe a week from now to see if we can do another x-ray or just to see how the tooth is progressing. This situation really reminds me of the fact that I had the ability to volunteer at a cancer center. And there, the task that I was doing is I was working with physicians and clinicians and patients, writing machine learning code line by line to help us predict whether or not a patient would respond to a kind of treatment or not. And I learned firsthand from writing the code myself what some of the pros and cons of using AI are. I realized that fundamentally, the data in which we're using to train our model on is really important. And whenever it comes to using AI in healthcare, it's really important that we reflect on what data are we training our models on? Is it the case that if our patient is young and from rural Africa, are we using data that is trained from someone who is old and is from North America? These are the questions that we have to make sure that we ask. And moving forward in my career as a dentist, when it comes to the implementation of newer technologies, things like AI and new policies, it's important that we consider both the pros and the cons, the limitations and the benefits of using these kind of technologies moving forward. I believe that by having this approach, it ensures that we are being clear with our patient and giving them the space to ask any questions if they need, and ensuring that they understand where our diagnosis is coming from. And so with that, I'd love to answer any follow-up questions. Thank you.